Welcome to my YouTube channel RX Farm Academy. I hope you all are enjoying the best of your health and I hope you are not suffering from anemia. But if you do, you have to get to know about anemia, and here is the video for you. Anemia is a very common problem. Many of us suffer from anemia at some of the times in our lives due to certain reasons, due to certain diseases. And ladies may suffer from anemia during pregnancy for sure, and all of us know anemia means deficiency of blood, and there is pale skin, weakness and fatigue. And yes, that's right. Let's discuss about it in detail, about its types and causes one by one. Watch full video till the end, and if you are students, you may take the screenshots, you may learn by heart and memorize it and present it in the exam or viva or interview or whatever you are preparing for. Okay, let's start with the anemia. Anemia is derived from ancient Greek word an means not and hema means blood. So anemia means not blood, less blood or deficient blood, whatever you say. It occurs when you don't have enough red blood cells or when your red blood cells do not function properly. Red blood cells carry hemoglobin, an iron-rich protein that gets attached to the oxygen in lungs and carries it to the tissues throughout the body. Inside the figure, you may see that there is a structure of the hemoglobin in which there are two kinds of the polypeptide chains. One is the alpha chain, one is the beta chain, and there is a heme portion which contains ferrous ions, and yes, this is the exact point where the oxygen gets attached. Anemia is diagnosed when a blood test shows Hb value less than 13.5 grams per deciliter in man and Hb value less than 12 grams per deciliter in a woman. So these are the symptoms like dizziness, lightheadedness, a fast or unusual heartbeat, pain including your bones, chest, belly and joints, problems with the growth for the children and teens, shortness of breath, skin that is pale or yellow, cold hands and feet, tiredness or weakness. Further, it is confirmed by the diagnosis, the blood test, which is a complete blood test, CBC, will measure your red blood cell hemoglobin, blood smear or differential count your white blood cells, check the shape of your RBCs and look for the unusual cells, reticulocyte count to check for the immature RBCs. So this is a figure which shows all kind of the size variations. First of all, there is a normal disc like shape of the RBC. Normally it is disc shape, and when it is microcytic, it is smaller than its size. The normal size of the RBC is 6.7 to 7.8 micrometer. When it is microcytic, it is less than this normal size. When this is macrocytic, this is larger than this is normal size. So other shape variations are there on the right side of the table. So spherocytes are important, in which the RBCs are sphere shape, not disc shape, and this is the more fragile shape. We shall discuss it later. And sickle shape, in which there is other than the disc shape, it is shrinked to the moon shape. So talk about the classification of the anemia. There are three major kinds of the anemia due to the hemoglobin portion. This is microcytic anemia. Microcytic means the red blood cells that are smaller than the normal. Hypochromic means its color is less than the normal. My microcytic anemias are iron deficiency anemia, thalassemia and sickle cell anemia. Other type is normocytic anemia, in which the blood size, RBC size is normal, and normochromic means Hb level is normal. Acute blood loss, chronic disease, aplastic anemia, hemolytic anemia, these are the types of normocytic anemia. Macrocytic anemias, in which the size of the RBC is larger than the normal. It includes vitamin B12 deficiency and folate deficiency anemia. Let's discuss these types in detail. Iron deficiency anemia, the most common type of anemia. It happens when there is no enough iron inside the body. The causes are inadequate dietary intake of iron, increased loss of iron due to blood loss, increased demand of iron due to pregnancy or childbirth, decreased absorption due to certain diseases like Crohn's disease, gastric bypass surgery. The human body stores iron in the form of ferritin and hemosiderin. It's important to discuss about the ferritin and hemosiderin, which are the iron stores of inside the body. Ferric iron in the body stored as ferritin in the liver, spleen, and muscle tissue and bone marrow, and it is delivered throughout the body by transferrin, a protein in blood that binds to iron. Ferritin is primary iron storage mechanism in cell that makes iron available for critical cellular processes. And the other is hemosiderin. It is an iron storage complex that is composed of partially digested ferritin and lysosome. The breakdown of heme gives rise to the biliverdin and iron. The body then traps the released iron and stores it as hemosiderin in the tissues. Vitamin deficiency anemia. The first type is megaloblastic anemia, when you don't get enough vitamin B12, folate, or both. Vitamin deficiency is due to poor dietary intake. If you eat little or no meat, you might not get enough vitamin B12. If you overcook the vegetables or do not get enough of them, you might not get enough folate. Pernicious anemia is another type, when your body does not absorb enough vitamin B12, which may be due to poor dietary intake, malabsorption due to gastric causes. An exclusive symptom is swollen red tongue or bleeding gums. These are the exclusive symptoms of pernicious anemia. Megaloblastic anemia or folate anemia. As we all know, folic acid is important for the synthesis of the DNA inside the body. So in megaloblastic anemia, as you can see in the figure, these are the megaloblasts. Megaloblasts are what? These are abnormally large RBCs caused by defective DNA synthesis due to deficiency of vitamin B12 or folic acid. Red cell indices like mean corpuscular volume, mean corpuscular hemoglobin, and mean corpuscular hemoglobin concentration decreases. Other type is hemolytic anemia. Hemolysis occurs when red blood cells are broken up in the bloodstream or in the spleen. The causes are: number one, infections due to cytomegalovirus, hepatitis, typhoid fever, and the toxins like spider venom, snake venom. Autoimmune diseases in which your immune system treats the RBCs like foreign material. Autoimmune diseases that include the systemic lupus erythematosus, Crohn's disease, rheumatoid arthritis, ulcerative colitis, and certain cancers are also included in it. Mechanical causes may be there due to leaky heart valves and aneurysms. Congenital abnormalities are also there causing the hemolytic anemia. Inherited abnormalities that may affect the hemoglobin or the red blood cell structure or function. Examples include thalassemia, we will discuss about it later, and low levels of enzymes like glucose 6-phosphate dehydrogenase deficiency. It is also very important. This is also due to an X chromosome linked congenital abnormality. G6PD enzyme is located on RBC's membrane and is important for cell differentiation and maturation. Without this enzyme, oxygen carrying capacity of RBCs is very less and cell death may be there. Sickle cell anemia. In sickle cell anemia, RBCs are shaped like sickles or crescent moons. These sickle cells become rigid and sticky, which can slow or block the blood flow. Sickle cell anemia is an inherited hemolytic anemia in which the hemoglobin protein is abnormal, causing the RBCs to be rigid and clog the circulation because they are unable to flow through the small blood vessels. As you can see inside the image, that in sickle cell anemia, it is clogged inside the veins and the veins become so painful and swollen. Thalassemia. Let's talk about thalassemia. That's very important. You might have heard about it many times in life. Thalassemia is a genetic disorder that may range from a mild abnormality of blood to severe or fatal anemia. This condition can range from mild to life-threatening. The most severe form is called Cooley's anemia. Severe thalassemia is treated by blood transfusions, and minority of the patients are cured by bone marrow transplantation. So these are the genetic causes due to which the thalassemia is there. There are two kinds of the thalassemia. In alpha thalassemia, there is a deficient synthesis of alpha chain. The resulting excess of beta chain binds oxygen poorly and leading to a low concentration of oxygen in tissue, hypoxemia. In beta thalassemia, there is a lack of beta chain. The excess Alpha chains can form insoluble aggregates inside the red blood cells. These aggregates cause the death of red blood cells and their precursors, causing a very severe anemia. The spleen becomes enlarged as it removes damaged RBCs from the circulation. Aplastic anemia. As all of you know, that the RBCs are synthesized inside the bone marrow. So in normal bone marrow, these are the stem cells of RBCs, and aplastic anemia, there are less stem cells of RBCs. Let's discuss about it in detail. It's a rare bone marrow failure disorder in which the bone marrow stops making enough blood cells, RBCs, white blood cells, and platelets. It occurs as a result of destruction or deficiency of blood forming stem cells in bone marrow. Viral infections, ionizing radiations, autoimmune disorders, and exposure to toxic chemicals or drugs can also result in aplastic anemia. Anemia of chronic diseases. If you have any of the following chronic conditions, you might be at a greater risk for developing anemia. These conditions are rheumatoid arthritis or other autoimmune diseases, kidney diseases, cancer, liver diseases, thyroid diseases, and inflammatory bowel disease, which is also called Crohn's disease or ulcerative colitis. It's important to talk about the lead poisoning, because whenever the lead poisoning is there is less amount of RBCs inside the blood. Lead is toxic to your bone marrow, causing you to have fewer red blood cells. Lead poisoning can happen when adults come in contact with lead at work, or if the children eat chips of lead paint. If you can also get it if your food comes in contact with some type of pottery that are not glazed right. So lead is incorporated inside your food and it becomes toxic to you. Treatment of anemia. So talking about treatment of anemia, it depends what kind of anemia you have got. Aplastic anemia needs medication, blood transfusions, or bone marrow transplant in which you get donors' stem cells. In hemolytic anemia, it needs medication that will hold back the immune system. In iron deficiency anemia, there is a need to take iron supplements and change the diet. Iron deficiency anemia due to blood loss needs a surgery to find and fix the bleeding. If you have a vitamin B12 or folate deficiency, supplements will be prescribed. And in thalassemia patients, there is a need to have repetitive blood transfusions and bone marrow transplant and surgery. Erythropoietin injection. Whenever we talk about the anemia, there is important to talk about certain medications which are there to treat the anemia. Yes, iron supplements are there, folic acid, vitamin B12 supplements are also there, but there is an important thing which is called erythropoietin injection. Erythropoietin is a glycoprotein hormone naturally produced by the peritubular cells of the kidney in renal cortex. It causes the bone marrow to produce RBCs. The normal range inside the body is 2.6 to 18.5 milliunits per ml. If there is too little erythropoietin, which is usually caused by chronic kidney disease (CKD), there will be fewer red blood cells resulting in anemia. E-poietin injection is made by recombinant DNA technology for the treatment of anemia that results from chronic kidney failure. This is the e-poietin injection which is sometimes prescribed by the doctor after dialysis to the patients which are on regular basis going for the dialysis. 2000 international units, 4000 units, or 6000, whatever the doctor prescribes, you have to give it to the patient. Ferinject, this is a very a good kind of medicine to treat anemia. Ferinject 500 mg injection, which contains ferric carboxymaltose FCM. It is an iron replacement medicine. Iron is needed to produce red blood cells, used to treat those types of anemia where RBCs are less due to insufficient iron inside the body. Iron deficiency anemia, like there is. So we have discussed everything about the anemia. So this is the quiz time. You have to remember what you have studied in past and inside this video, that what is the lifespan of RBCs, what are the RBCs produced, and where are the RBCs destroyed, what are the chronic diseases which produce anemia. So that was all about today's video. Thanks for watching the full video. Do not forget to like and share it with your friends. Support my channel, and I want the gesture from your side to be shown in the comments. Are you getting the topics or not, and what other kind of the topics you want me to bring to you on this channel. Till then, take care. Goodbye.